the idea of having sex while you're pregnant is sort of, it's safe, number one, and like on a scale of 1 to 10, how much ick factor is there for the baby? Because it feels,
How much ick
I don't know,
factor?
Ick factor.
Have you
Yes.
asked
in your medical
children?
opinion?
Have you asked your children if they recall?
I don't want to talk about it with them. I don't want them to have any other ammunition in therapy, so I haven't brought it up.
Fair, totally fair. So, first and foremost, sex in pregnancy is extremely common. People do have sex frequently, sometimes as much, sometimes more than prior to pregnancy. Not all women experience changes in their sex drive, but a lot do. Some have less interest and some have a lot more interest. And sometimes it changes like where you are in the pregnancy and how that feels. So number one, the answer to all questions about sex and pregnancy is do it if you want to, right? If you want to and your partner wants to and you guys are feeling happy and good about it, go for it. Unless your doctor has specifically told you that for some reason, some medical complication of your individual pregnancy, sex in pregnancy is safe. Ick factor wise, the baby has obviously no conception, to use an appropriate term, no conception of what is going on. They are experiencing movement all the time in the uterus, right? They're floating in some water and they get bumped and, bounced around. But there should be no discomfort. There should be no contact, period, between what's happening between you and your partner and what's happening to the baby. So no ick factor.
Okay. And just to follow up, going off script a little bit, 6 weeks after, what are we waiting for? Does that window need to be extended for the next generation? Talk a little bit about that.
Full disclosure, I really looked into this a lot after I had my baby, because I was like, I don't, we're taught this, but I don't really understand. And is it safe? Is it unsafe? I think the theoretical idea is that there's still changes that are happening in the uterus. Often women are still bleeding for up to 6 weeks. And so there could be some possibility of disturbance, infection, that kind of thing. Certainly if you've had vaginal trauma or obstetrical trauma, it's important to allow your pelvic muscles to heal, and sex is a vigorous exercise of your pelvic muscles most of the time. And so we discourage that because we don't want you to be incontinent of urine or stool, just, for the pleasure of having sex a few weeks early. That said, if you're feeling fine, if you're peeing and pooping fine, if your partner and you, both of you, want to, it's probably okay. And it's definitely okay to wait a lot longer than 6 weeks too.
Right. First ladies, it's okay to wait longer.
Yeah. Great question. And I would say, even like when my wife first became pregnant with our first child too, like even for the guy, there's that awkwardness of like, is this okay? Like, like you said, it feels weird. It feels a little creepy. Like you said, the ick factor, even for the guy, it just felt a little bit strange to me. And like you said, so I'm glad this question came up. Yeah. I think it's good for both to kind of hear that, if, like you said, and if you're both willing and able, then it's okay. So that's good.
And I mean that very seriously, because it is important to acknowledge that intimate partner violence is much more common in pregnancy than at other times in women's lives. Women are really vulnerable during that particular time. And so if your partner is pressuring you and you are not interested and they're not getting the message, or if you have been coerced into sex, we want to know, we want to help you. So please don't feel ashamed. Like you should come to us. We have resources and we can do things to make sure that you're safe.
Outstanding. Thank you for bringing that up too. I appreciate that. That's excellent.